4:30 today is Melanoma Monday. It's a day to raise awareness for the most serious form of skin cancer.
And joining us now to talk about this is Dr. SAJID Khan, Associate Professor of Surgery at SMILOW Cancer Hospital and Yale Cancer Center. Thank you so much for being with us. We appreciate it.
Thank you, Aaron and Mark, for the invitation to come out here. I appreciate it.
So first off, we really are seeing more cases of melanoma in the U.S. Why is that?
Yeah, so melanoma for the last few decades has been on the rise, according to the American Cancer Society in the United States, and and it's for a combination of factors. Some of it includes exposure to UV light and tanning bed, and some of the things that we've seen in prior decades of patients' lives, and some of it also has to do with people are living longer, and in general, we're seeing a reason for the rise in melanoma because of that.
Doctor, you're actually seeing higher numbers in women. Is that true?
So in general, for melanoma, women are more likely to get melanoma at under the age of 50, and over the age of 50, men still have a higher rate of development of melanoma in that age group. So, and even though melanoma is something that we think of with, we think the average diagnosis of melanoma is about 65, there are young patients that are prone to developing melanoma as well, too, and we see that in our clinics here at SMILOW.
My mom is a melanoma survivor, so it's something I take very seriously, getting skin checks and doing all the right things. What are some of the causes of this deadliest form of skin cancer, and what can you do to prevent it?
So, well, I'm happy to hear, Aaron, that your mother is a survivor of melanoma. There's about 1 million of them in the United States, and I'm happy to hear that she's a survivor. There are risk factors for the development of melanoma, which we screen our patients for at SMILOW when they come to our clinic. And a lot of it has to do with UV sun exposure. In a history of sunburns, and particularly sunburns with blisters, can be a risk factor in one's life. Use of tanning salons is also a risk factor for the development of melanoma. A personal history of melanoma is another risk factor for the development of melanoma. And those are the most common reasons that the risk factors for the development of melanoma in one's lifetimes. And things that one can do to have a good outcome in melanoma is to make sure you see your dermatologist. Today is Melanoma Monday, and then this is a good way to think about that. So have a dermatologist, have an annual skin check with your dermatologist. And early stages of melanoma tend to have much better outcomes than patients with later stages of melanoma.
Obviously, doctor, one of the things here is paying attention to our bodies and moles especially, right? And if we see any kind of change, when you say change, what does that mean? What should people be looking for?
Yep, so that's a great question, Mark. And the thing that we try to tell our patients is to try to keep it simple. And one easy thing to remember is the A, B, C, D, and E of melanoma and skin cancer in general. The A stands for if you see an asymmetric mole or an asymmetric skin lesion, that should warrant attention. B stands for borders being irregular, if one sees a skin lesion with an irregular border. C means color variation, so a single skin lesion with different colors throughout. D is diameter, and I mentioned to my patients, is it larger or smaller than a pencil eraser? And the last is E, which is the most important, which means evolution. So if there's a change or an evolution of one's pre-existing skin lesion, those are some things that should warrant attention and have one see a dermatologist.
Well, some really good information there. And when in doubt, always see your dermatologist and get your skin checked just to be safe. Dr. SAJID Khan with SMILOW Cancer Hospital and Yale Cancer Center, we really appreciate you being with us today. Thanks for all you do.
Thank you again, Aaron and Mark, for the invitation.